we talked about this earlier. Information. That's what we need. We need accurate, important information. It's tough to come by in a pandemic. Things change. Some things we do know. Some things we guess. Some things we just don't know. We had on our program last week, I believe it was, the chair of the Department of Internal Medicine at Pacific Northwest University Health Sciences, Dr. Mark Baldwin, and he's graciously agreed to come back and put up with us again. So, Doctor, good to have you on.
Morning, gentlemen. Hope you are well.
So far, so good, sir. So far, so good. I had a brief chat with you yesterday about how it was changing things at the college there. Let's start with that. Are people still about the business of learning medicine today?
Yes, but in a different form. We had a couple weeks ago when we realized that we were going to have to get away from traditional in-class lectures. We've moved to an online platform, and so last week we were scrambling around to kind of get the content up and get it delivered, and we're doing well, and the students are adapting to it. The faculty is adapting to it. We got a great support staff. So,
do we have any kind of concern about a fall off in actual learning from sitting there with the professor as opposed to taking notes and watching the screen? Do we think, has there been any kind of studies done that the quality of education doesn't suffer from the delivery system? Do we know?
I think that you and I may be suffering from our age. Younger people are really much more plugged into it, so they seem to be enjoying it. We record all of our lectures normally, and the students can go in and review lectures at another time. So this is not a problem.
Nothing big there. Yeah, well, you're right about age.
So far.
So far, so good. I know people that went to Jurassic Park looking to see me, so I hear you on the age thing. All right, with that, with knowing that education is underway, one other question, and I don't expect that you maybe have an answer, but you might have a thought. As we see colleges doing this more now in order to keep students engaged, and high schools are scrambling around and looking for ways to do this. Could this ultimately, think of what it costs to maintain a college campus and everything that goes with it, when you could learn many literature, art, history, a lot of stuff online that you wouldn't need a cadaver to practice on or a lab to be in. Could this have a long-term impact on how we deliver education, do you think?
Well, we already know there's a number of online courses that people do. You can get an online degree in a number of things. So that part, has already been established. For something where you have to have personal interaction, we still need that, at least in medical schools, law schools, and I think general education, too. At one point or another, you have to meet up with people. So,
gotcha.
But
all right, go ahead.
That's it.
All right, Doctor. We're talking with Dr. Mark Baldwin from the great teaching university here in Yakima, Department of Internal Medicine chairperson. Keeping up with what's been going on, we are now, Lance, did you say 202 cases?
202 cases, right.
202 cases.
3 deaths.
And 11 people either in hospital now or have been. We kind of look at doctors and think that, you guys know everything about everything. We know their specialties, and somebody who can, go in and reconnect your intestines may not know how to cure a rash because you're specialists and stuff. But you've been following this, obviously. Does this track about like how you might have thought it was going to track in Yakima in terms of number of cases and how fast it's growing?
Yes, it does. It does follow the models. Probably one of the real pioneers in modeling this comes out of our own University of Washington, has done a terrific job of, since Seattle was on the forefront of the first reported infection in the United States, they've had time to look at the trends and projected cases down the road and deaths. The one thing that's kind of hampering everything in the United States is the lack of rapid available testing. That has been, and I think a lot of these cases, and I think the experts will agree with me, that a lot of these cases, I think, without testing, we don't know. We have presumed evidence, but without an accurate test, we can just put down as suspected. So what's being reported are proven tests by either blood tests or by nasal swabs.
What have you learned in the last week that you believe is maybe is new information that we all need to know, Doctor?
Just how I think reminding that nature always holds the ace up their upper sleeve. That we may be able to go to the moon, be able to cure cancer and that, but it's still the little invisible microbes that still have the last say so. And just reminding everyone that the basic principles of social distancing, hand washing, and that play such a big role.
Are you wearing a mask?
As I'm talking to you, no.
No, I'm not sorry, but no.
Although we recommend that, sir, just so you know.
Or earplugs.
Yeah. Hey, we do the jokes. You do the surgeries. We do the jokes, sir.
Yeah, they don't allow me to have sharp objects in my hand. So,
well, there's been recommendations to wear a mask, and other people say don't wear a mask. So where do you sit on this?
I think wearing a mask certainly doesn't hurt, and it does filter out. Even a simple, flimsy mask does filter out some particles. Again, the N95, which is really the standard for protection, is not really readily available right now.
Right. Yeah.
But some type of protection, and again, one of the best things is keeping your distance from people.
But, is this thing just floating out in the air as I'm walking through the parking lot or something? Do I have to start wearing, using tape around my doors because it's coming into my home? This is getting a little crazy, it seems like.
Well, I think it's better to err on the side of caution than not. And I think right now that's our reality. So...
All right.
I don't know if that answers your question, but yeah.
It kind of does. We're talking with Dr. Mark Baldwin from Pacific Northwest University Health Sciences. He is the chair of the Department of Internal Medicine and kind enough to spend some time with us this morning. I guess what we're seeing, I looked at a graph on, I don't know if it was Wired website or something, but it showed... it's one of those standard L graphs. I don't know what you officially call them, but number of cases up the one side and duration of impact along the bottom. And like if this thing were to spike and we didn't do anything, there'd be a certain death toll, and then it would be over. And it would be, according to what these look like, it'd be over much sooner than what the flattening of the curve is. The flattening of the curve actually is going to mean that we will be dealing with it in some fashion longer than if we had just taken the spike. Now, the spike represents dead people, so obviously that's the issue. But we're hearing we're spending $2 trillion now, and how much more is coming later. Do the medical folks? Do you guys ever have to really factor in long-term impact to community, economy, that sort of thing? I know your sworn mission is to protect life, but how do you guys calculate that into actions that might need to be taken?
If we can prevent deaths, that's our ethical obligation. Even with the let business go on as usual. That also assumes that everyone will have equal exposure, which is not the case. Even with that, you can still have resurgence of this. The best effective method is letting the virus burn out on its own.
So
I mean, again, how much of a price do you put on your loved ones?
Yeah.
Is it worth your loved ones dying so we can keep the economy going? I mean, the economy's going to survive as it is because, what we need to realize is everybody is in the same boat in the United States. It's not like, we have the corner on the world suffering market and everyone else is doing great. No, it's just the way all over.
Right, so we all get to suffer. By the way, for the record, I just want to say that my younger brother, he could maybe be one of the ones to go. I'm just saying, it's a whole family thing. But that goes back. That goes back 20 years, Doc. And I don't want to get into the details. But, all right, so I guess
let me give you an example. Look at the situation in New York. As of earlier today, they had well over 1,000 deaths and 1,960 deaths as of yesterday. They have that's just in one big city, and I think you look at why New York. Everyone in the world goes to New York. It seems they have and that just with their dense population just put a match to a can of gasoline.
Sure. But what would they lose from the regular flu without us doing all of this? How many folks would be passing away from just the annual flu? And I guess that's the problem with some of us non-medical types out here that are doing the comparison.
Well, last year, since you asked, there were 6,500 people in the United States who died of the flu. Okay? This is on top of the annual mortality from flu. Okay? So, yeah, you have the people who died up to this point of the flu, and then you have COVID-19 that is also taking out more people.
Well, some of the stats that we saw the other day, and maybe you can shed some light on this, Dr. Lance. You said between September when flu season started until
CDC right now estimates that from October 1st of 2019 through March 21st of 2020, there have been 38 to 54,000 flu illnesses and 24,000 to 62,000 flu deaths. Now that's
okay.
That's
so if we've got 24,000 from the flu to this point, and in the nation, are we over 3,000 now? You're still talking 8 times. I know the spike's coming. They say in a couple of weeks, right? Isn't that the projection?
Right. That's the model. Probably about the middle to late April is the projected model, and so far already greater than 4,000 people have died of this.
Right.
And we haven't even ramped up yet.
Gotcha.
So.
But I just we keep going back to the flu. Why is it okay for the country to have thousands of flu cases that are killing people, but COVID-19 we're freaking out with a much lower number?
That's much lower number right now. We'll see. We'll come back and look at that in a month and a half, and see when we have, hopefully by then, rapid available testing. And say, okay, this is on top of our annual mortality of the flu. Plus, we have a vaccination for a lot of strains of the flu.
Sure, yeah.
Not everyone, but we don't have that, and we don't even have an effective treatment right now. There are a number of things that are being tried, but the French study on hydroxychloroquine has been really raked over the coals for a number of reasons. So until we can do this in an independent study and look at this, we're all,
still shooting in
we're
the
all
dark,
kind of scratching our heads.
Yeah. Well, there's talk now too. We got about a minute to go, Doctor. We talk of that it's going to maybe come back in the fall. Is that how these things sort of work?
There may be. It may be. Again, it depends upon how effective it happens. The reason in the summer and the spring why these illnesses go down is partially UV radiation, but also people are outside. They're not cooped up together.
Sure.
So Yeah.
Makes sense. Doctor, thank you for your time this morning.
you,
Hey, no
Doctor.
problem,
Appreciate
guys.
it.
We look forward
Okay,
maybe
have
to
a good day.
chatting with you down the road, sir. Thank you.